Welcome to another episode of Youth Diary. Dermatology deals with the problems of hair, skin and nail. And today we have Dr. Deepa with us. She is a consultant dermatologist. Hello doctor, welcome to our show. Doctor, can you just explain what are the common skin problems that are encountered by the youths?
Adolescent period is a beautiful period in one's life, and adolescent period is associated with so much of body changes, and so that too leads to so much of turmoil in their minds. That is why they are more worried about their cosmetic problems. And the common dermatological problems associated with teens are pimples or acne vulgaris, problems with hair loss, problems with pigmentation, problems of nails, premature graying of hair. These are the common skin problems associated with teens.
Okay. So we'll go to the questions, doctor.
Hello ma'am, I am Nandita. I am from Amrita School of Arts and Science. How much hair loss is considered normal?
Hair loss can be due to many causes. It may be due to nutritional deficiency, it may be due to vitamin deficiencies, it may be due to dandruff, which is the commonest problem encountered in the adolescent age group. As a part of dandruff, there will be scaling of the scalp. Along with that, there will be hair loss and itching of scalp. That can cause so much of psychological problems in the adolescent age group. Then other causes are drug intake, other disorders like endocrine problems, thyroid problems, diabetes, application of so many cosmetics. All these can cause hair loss.
Okay. What about this insufficient nutritional intake, doctor? Will it be causing?
That is a very important cause in the teens, because nowadays, because of lifestyle modifications, people, because of the fast life, people go in for a lot of fast foods which are deficient in the usual nutrition during the adolescent, especially in the adolescent period. Like vitamins will be depleted, proteins will be deficient, and all the fast foods contain almost white, like maida, white rice, etc. All these white sugars, all these produce a lot of nutritional deficiencies that can cause hair loss, especially in the adolescent age group.
I think nowadays it has become so common that hair straightening and other chemical treatment of hair. Will it be harmful to the hair? Yeah,
in the long run, hair straightening and excessive use of hair cosmetics without giving much care. If you do hair straightening and other hair procedures, you have to care the hair daily. But when there is one is irregular in such routines, that can cause a lot of hair breakage, hair dryness. You have lusterless hair, or hair won't be shiny, and hair will be brittle, and hair loss can occur.
So how will you manage the hair loss, doctor?
Usually we have to investigate the patient for the cause of hair loss, and you do a lot of investigations, blood investigations, thyroid hormonal levels are checked, and you find out the cause and you treat according to the cause.
Okay. And another thing, nowadays there are a lot of hair oils available in our market. Is it really useful to prevent the hair loss?
Actually, that has a psychological effect only, but medically speaking, it doesn't cause much of improvement in the hair growth.
Okay. മറ്റൊരു കാര്യം ഡോക്ടർ, നമ്മുടെ ചില ലേഡീസിൽ നമ്മൾ കുറച്ച് കഷണ്ടി പോലെ കാണാം, ബാൾനെസ്. Is there any treatment for that? Medical treatment, or is there any drug?
Also, normally after 30-35 years of age, one can start developing baldness. That may be genetic. So usually we take a detailed history, see whether if it is genetic, you don't have much of treatment. Otherwise, you can stop the progression of the baldness by giving hair vitamins, and other products are available which will increase the hair growth and which will decrease the hair loss. Thereby we can prevent the progression of the baldness.
Okay, doctor. So we'll see the next question.
Hi ma'am, I'm Srividya from Amrita School of Arts and Science. Ma'am, how to control oily skin?
Oily skin is actually common in adolescent age group, because as a part of hormonal change, one have increased activity of the oil glands or sebaceous glands. So naturally itself there will be a lot of oil secretion in the adolescent age group. Otherwise also we classify skin into different types. That is mainly have a genetic influence. So some persons will have oily skin, some persons will have dry skin, some persons will have combination skin, and some will have sensitive skin. Application of oil-based cosmetics or comedogenic substances will occlude the skin pores, and that can lead to so many skin problems, especially that will exacerbate acne in an acne-prone skin. And you'll have seborrhea, increased oiliness of the scalp and hair, that will lead on to seborrheic dermatitis, which is an excessive form of dandruff. Dandruff is actually a normal phenomenon which no one has to worry about actually, but when it becomes excessive, that is with increased itching of the scalp, increased hair loss, and development of small follicle-like lesions or small pimples on the scalp, all these are due to excessive application of oil on the scalp and skin. So oily skin, persons who have oily skin have to take care of their diet. They have to avoid oil-rich food, that is pastries, all sugary drinks, fried foods, everything should be avoided, and they have to use plenty of fruits and vegetables, especially fruits rich in vitamin C. Should be used, green leafy vegetables should be used, they have to drink plenty of water. All this will make your skin beautiful.
What are the tips that doctor can give to our viewers to help to reduce the oily skin?
Frequent washing of the face at least 3 times a day using mild cleansers will help reduce the oiliness of the skin and will reduce the oil secretion. Avoid oil-based cosmetics or comedogenic substances. Avoid excessive cosmetic usage on the scalp and skin. Avoid all cosmetic procedures which will contain so much of oil-based preparations. Eat plenty of vegetables and fruits. Avoid fast foods. Avoid white foods containing maida, sugary drinks, cola, Pepsi, etc. And drink plenty of water and be stress-free in your life. That will decrease the oil secretion.
Okay. So doctor, you talked about the dry skin also. So what are the remedies for the dry skin?
Dry skin usually will have dryness of the whole face, scalp, skin, and especially of the extremities. So dry skin people should use frequent moisturizers. Moisturizers should be applied after each bath. That is, moisture should be there, and that on top of the moisture you have to apply moisturizing lotions or creams. And they have to also eat a lot of nuts, seeds, sunflower seeds, walnuts, peanuts, etc., which will increase the oil production in the body. Frequent washing or frequent bathing can increase the dryness of the skin. So ideally we ask them to avoid frequent washing of the skin. Once a day washing is normal, but excessive washing should be avoided, which will increase the dryness and can cause problems due to dryness like fissuring, chapping, etc.
Are there any soaps for dry skin?
Dry skin persons can use soaps which contain moisturizing agents, or oil-based preparations can be used frequently. But minimal use of soap is advised, because excessive use of soap and water will again increase the dryness of the skin. And you have to avoid sitting in excessive air condition and excessive windy climate, because that even can cause dryness of the skin. In such situations you have to use protective clothing which will cover your skin completely.
Doctor, what about this Ayurvedic oils and all this thing? Like നമ്മൾ ആയുർവേദ എണ്ണ എന്നൊക്കെ പറയില്ലേ ചിലപ്പോൾ തേച്ച് കുളിക്കാനൊക്കെ.
Ayurvedic oils does not have any special effect. Only thing is they'll have the oily effect on the skin. But some persons can even have irritant dermatitis because of Ayurvedic preparations. And excessive oils, application of Ayurvedic oils sometimes can produce folliculitis and acne even in some persons.
Hi ma'am, I am Ramya from Amrita School of Arts and Science. How to prevent dandruff?
Dandruff is a normal phenomenon. That is usually your skin, the superficial layers of the skin will be shed off. But when it is associated with itching, hair loss and flaking of the skin, that is called as pathological dandruff. That is called as seborrheic dermatitis in medical terminology. And persons with dandruff usually can have dry scalp skin and oily or greasy scalp skin. Those with dry skin on the scalp, they can use oils, and those with greasy skin on the scalp should avoid oil application. And seborrheic dermatitis, it's actually an endogenous eczema. It is exacerbated during summer due to stress, due to application of so many oils or comedogenic substances, due to hair treatments, and in certain diseases there will be increased incidence of seborrheic dermatitis. In such cases you have to evaluate the patient and do relevant blood investigations and then choose the treatment. Otherwise, to prevent dandruff, you have to use mild minimal oil in dry skin and avoid oil in oily skin. Then every day you have to wash the hair and keep the hair dry. And dandruff and seborrheic dermatitis are usually common in the adolescent age group, that too due to hormonal changes because of excessive oil secretion. And you have to avoid oil based food, then oily preparations. Can use shampoos, anti-dandruff shampoos, especially medicated shampoos are available which contain ketoconazole and zinc pyrithione, which will reduce the scaling. And because seborrheic dermatitis has a fungal etiology, shampoos containing antifungal agents will take care of the fungus, and that will reduce the scaling of the scalp and itching of the skin of the scalp.
So how often do we have to use that, doctor?
We advise thrice a week application, and you have to apply the shampoo and rinse it for 3 minutes and then wash the scalp hair.
Okay. Doctor, we have heard like many of them saying by sharing the comb.
Because of fungal etiology, when you share combs and even towels, it can cause dandruff.
So doctor, is there a permanent cure for dandruff?
It is prone in eczema patients and it has a genetic influence, and it is a type of endogenous eczema. It can have recurrence. So you have to take care of your scalp and hair daily to prevent recurrences. And it can exacerbate during CC. It has seasonal variations, and when there is stress you can have increased exacerbation. So it is a disease with recurrence.
So we'll see the next question, doctor.
I'm Adira from Amrita School of Arts and Science. What kind of cosmetics an acne person can use?
Person with acne prone skin should avoid oil based cosmetics. They can use gels or lotions which are not oil based.
Doctor, are there any diseases that will lead to these types of acne?
Yeah, in the usual run, acne will disappear by about 30-35 years, or they respond to the usual modalities of treatment. But when they are not responding to the usual modalities of treatment, we have to think of so many endocrine problems which can lead on to acne, especially in a girl with obesity, increased excessive hair growth, excessive oily skin, and irregular periods. You have to think of polycystic ovarian disease, which is the commonest problem which is associated with acne. In such cases, you have to tackle the basic problem, then you will have complete clearance of acne even without any other treatment for acne.
So in normal acne, what are the treatment modalities, doctor, that we?
Usually we classify acne into different grades. That is, mild acne is grade 1 and grade 2 acne, which contain mainly comedones and few pustules, and grade 3 and grade 4 acne which have severe acne, which are classified as severe acne. In mild acne, usually you need only topical preparations. For severe acne, we give systemic medications like systemic antibiotics, which are given long term, and that is up to 3 to 6 months is given or till clearance of acne lesions, and topical antibiotics are available, preparations containing clindamycin, then topical anti-inflammatory agents, preparations containing benzoyl peroxide, topical retinoids, preparations containing tretinoin and adapalene. All these are used topically for mild acne. They'll clear the comedones, they are comedolytic, they'll take care of the inflammation, they'll reduce the inflammation, they'll reduce the pustule formation, and gradually the acne will be cleared. In severe acne, the wonder drug for acne, especially in grade 4 acne, is isotretinoin, which is a systemic retinoid, but that should be used with caution. That is, you have to evaluate the patient by doing a blood investigation, make sure that their liver function is normal and their lipid profile is normal, and you rule out other diseases, and then you start on isotretinoin, which is a wonder drug for acne, and that will clear the acne, that will clear all the pathogenic factors in acne, and within 4 to 6 months you have a clear skin.
So we'll see the next question, doctor.
Hi ma'am, I'm Nandita from Amrita School of Arts and Science. How and when to use sunscreens?
Nowadays, because of a lot of environmental pollution and fast life, regular use of sunscreen is very important in maintaining your skin beautiful. So even after the age of 30, one has to regularly use sunscreens, and sunscreens are sun protective agents that protect your skin against the adverse effects of ultraviolet rays. Because of that, you have to apply sunscreen from sunrise to sunset, and every one sunscreen effect, if you apply sunscreen, that will be effective only for a period of 3 to 4 hours, and after 3 to 4 hours you have to reapply the sunscreen. Ideally, you have to carry the sunscreen with you all the time. When you are at work or when you are indoors also, you have to apply sunscreens. There are so many preparations available, that is physical sunscreens and chemical sunscreens. Always, whenever you apply anything on your skin, you have to test behind your earlobe and on a small coin shaped area, and see whether there is any irritation, any itching, any burning sensation, or development of redness that shows that you are you are sensitive to that preparation. So only after patch testing on your skin you have to apply anything on your skin. That too is applicable for sunscreens also, because sensitive skin persons can have problems even if you apply sunscreens. So sunscreens, there are physical sunscreens available and chemical sunscreens available. Physical sunscreens contain zinc oxide and titanium dioxide, which are not that sensitive, and for oily skin persons they have to use gels and lotions. Sunscreens which are gel based and lotion based, and dry skin persons can use oil based sunscreens. And regular use of sunscreen is very important. If you apply a high SPF sunscreen irregularly, that is not helpful compared to a regular use of a low SPF sunscreen.
Okay, doctor, that was really an informative talk. Thank you so much for spending your time with us. That's all for now. We'll see you in our next episode. Write your suggestion to us. Our email ID is youthdiaryrosebowl@gmail.com. Bye-bye.